Now here is the catch. I will tell you the top 5 killer diseases of the world, and then you'll know what COPD is. The first one is heart attack, second one is stroke, third one is road traffic accidents, and the fifth is cancer, not in that order of sequence. The fourth is COPD. All of us know about heart attacks, strokes, accidents and cancer. I bet you 10 in the 100 who's listening here may know about COPD. I would be really wonderstruck. But I think maybe less than 5% of the population understand or even at least have heard about the word COPD, and that is the top 5 killer disease of the world, chronic obstructive pulmonary disease, and that is so dangerous. And the point is, the first 5, the rest 4 like heart attacks, strokes, road traffic accidents and cancer is like, it happens by itself, by lifestyles and by genetic transmission, or you can say it is given by God. You don't believe in God, you say nature gives it to you. I got a heart attack, I got a stroke. But the irony of this COPD is that it is totally man-made. You don't smoke, you will never get COPD. Children never get COPD. If there is no air pollution in the world, there is not going to be any COPD. So out of the top 5 killer diseases, this is a totally preventable disease. It doesn't require treatment because you do not smoke cigarettes, you do not enter into air pollution, it never comes to you. But once it comes to you, it is dangerous, and it can turn out to be one of the most dangerous things that has ever happened to anybody's life, that it can kill you. And that is what chronic obstructive pulmonary disease is all about. And we in this program, as we keep talking to you, we will be expanding on to you about the various aspects of COPD more rather than asthma, because asthma most of us know about. We know it in different terminologies. We know it as, somebody calls it as eosinophilia. I don't have asthma, doctor, I have eosinophilia. There is a self-denial. Nothing to be worried about in asthma. Asthma is not AIDS. Even nowadays people walk out and say I have AIDS and nothing to worry about it. So asthma is very cool, nothing to worry about. And asthma is known in various names like allergic bronchitis, wheezy bronchitis, eosinophilic bronchitis. Sometimes they say I just have a cough and a cold, or sometimes they say, just to mask the term asthma, they say I have a sinus problem. Yes, you may have a sinus problem, but then you do also have asthma if you have the cold going down into your chest. Or they may just say I just have eosinophilia, and there is a denial saying I don't have asthma. You have to accept that you have asthma and then treat it. That is about asthma. About COPD, it's a totally preventable killer disease. Don't smoke, reduce air pollution as a community, as a overall society, and COPD won't come. But in case it comes, the first treatment is stop smoking. The first treatment is get out of the air pollution. That is what COPD is all about.
Whoa, doctor, chill. I'm a layperson. It's too much information for me. I do have some doubts though. The first doubt I have is that, can children get asthma?
Yes, unfortunately, the answer is yes. Children are most prone to asthma. And when you treat asthmatic children, that's a very good question. It is not like treating a young adult. It's not a pocket edition of an Oxford or a Lifco dictionary. Asthmatic children are a specialty by themselves, because within minutes they can crash and land up with ICCU or on a ventilator too. So yes, it's very important that parents understand that children can get asthma, and they have to be labeled as asthmatic and just not waved away saying that my child just gets a cough and a cold, or just has a eosinophilia, and you don't put them on inhalers, you just put them on tablets, syrups, age-old, age stuff, 1960 like vintage wine stuff. But you identify that they have asthma and give them the correct treatment, or you're playing with your children's lives.
Is asthma contagious?
Neither is asthma contagious nor is COPD contagious. So nothing to worry about any asthmatic at home. It's not like tuberculosis or anything else.
What are the different tests one can do for asthma?
The tests are very simple. You just do a very simple CBC, or a complete blood count, which is costing very less, an X-ray of the chest, an X-ray of the sinuses, which means the face here, and the pulmonary function testing, which is a computerized lung function testing, which is done through a computerized testing machine, and it is done before and after giving a nebulizer, which is a medicine in a liquid form. These are the 4 important tests, and they're quite cheap and is available in most part of the country, especially in the metropolitan and tier 2 cities.
What's the treatment that you prescribe for asthma?
The treatment available for asthma is, I can maybe grade it into 3 points, and number 1, the point is it is inhalers. The second point is again inhalers. The third point is again inhalers. I just said 1, 2, 3 because just to stress home the point that in India we have done a study, and that scientific study states that less than probably 2% of Indian people are using inhalers, and less than 2% of people, 2% of people, I'm sorry, are using peak flow meters. I'll be telling you what a peak flow meter is. Less than 2% are using that, and less than 10% are being told what asthma is all about, and maybe less than 30% of people have undergone any pulmonary function testing at any point in time. And also, since you're talking about asthma, I can also add that it's really alarming, and sometimes good to also know knowledge when it comes is alarming, is that you identify a target, you shoot it down. 50% of school absenteeism is only because of asthma. 10 children in the school don't come on a particular day, 5 is because of asthma. Now this is, I think a light up signal to the parents and also to the school authorities. 5 out of 10 children are absenting themselves from school because of asthma, because asthma has not been labeled or diagnosed as asthma. The reasons may be multifarious. It may be the people, the community, the country, the medical profession itself doesn't want to label the patient as asthma, because once you label a patient as asthmatic, the doctor is concerned, the patient may be worried and may not come back again. But no, the time has come, you have to label a child as an asthmatic and give the proper treatment. And when you come to adult asthmatics, when it's 50% in children that the school absenteeism is happening, in adult asthmatics, 1/3 of work absenteeism is because of asthma. Now watch out. India is a superpower, and imagine out of 100 workers, 33 workers are not going to come because of asthma. Imagine the amount of personal problems that 33% of people are going to have, their families, and also just try to convert it into the economic burden for the entire country, where 33% of the workforce is getting itself absenteed from work because of asthma. So the importance for asthma has to be highlighted. It is not being highlighted because it's still being camouflaged, it's still sort of not being said, yes, you do have this black, or you do have that white, or you do have that green stuff. People say, yes, I have a heart problem, people say I have blood pressure, people say I have diabetes, but people are not getting themselves labeled as asthmatics because probably the doctor-patient relationships have to be strengthened more, and continuing medical education programs and patient education program awareness has to creep in more. I think that's the reason.